Welcome to this promotional video sponsored by AstraZeneca. Hello, my name is Dr. Rohit Katyal, and I'm a practicing allergist at National Jewish Health. How many times have you had patients come to you frustrated over the lack of control of their asthma?
FASENRA is indicated for the add-on maintenance treatment of patients with severe asthma aged 6 years and older and with an eosinophilic phenotype. FASENRA is not indicated for the relief of acute bronchospasm or status asthmaticus. The treatment of adult patients with eosinophilic granulomatosis with polyangiitis, EGPA.
I've been prescribing FASENRA for my patients with severe eosinophilic asthma since it was approved in 2017, and I have seen firsthand what FASENRA can mean for appropriate patients. Let's hear from a real patient, Emily, about her asthma.
Thanks, Dr. Katyal. I've had asthma most of my life. A few years ago, I started to have more and more flare-ups, or asthma exacerbations. This required me to have a course of oral steroids, a shot of steroids, and use of my rescue inhaler more often. I went to 3 or 4 different doctors to try to get better control of my asthma, to no avail. I was traveling back and forth from Michigan to California to see my grandbabies. The thought of walking through the airports was daunting, and I felt like my breathing was declining. I knew in my heart that if I didn't address things, I would never get back to the things I enjoyed.
Thank you, Emily. Do you have any patients like this? Here are some key points from FASENRA's clinical trials that may make FASENRA an appropriate add-on therapy for patients in your practice with severe eosinophilic asthma. The FASENRA clinical program included 3 phase 3 studies, SIROCCO, CALIMA, and ZONDA. In the pivotal exacerbation reduction trial SIROCCO, in which FASENRA and placebo were administered in addition to the standard of care, inhaled medications, FASENRA demonstrated a 51% reduction in the annual asthma exacerbation rate compared with placebo. In the CALIMA study, a 28% reduction in annual asthma exacerbation rate was observed in patients treated with FASENRA plus standard of care versus placebo. Patients in the pivotal trials, SIROCCO, CALIMA, or ZONDA, had the option of continuing in the open extension studies BORA and then MELTEMI. MELTEMI was a phase 3 open-label safety extension trial with no control arm. MELTEMI study limitations included patients who did not experience benefits with their asthma treatment may have been more likely to discontinue the study versus those who did experience benefits. Similarly, patients who experienced certain SAEs in predecessor studies were not eligible to enter MELTEMI. These points could contribute to selection bias. In MELTEMI, the proportion of patients observed that had 0 exacerbations was at least 75% each year, and nearly 90% with 0 exacerbations was observed at year 5. Results are descriptive only. Over 5 years, FASENRA demonstrated a consistent safety profile similar to what was observed in the pivotal placebo-controlled trials. The most common adverse reactions with an incidence greater than or equal to 5% include headache and pharyngitis. In the MELTEMI open-label extension study, the most common adverse events greater than or equal to 5 per 100 patient years in the FASENRA Q8-week arm were nasopharyngitis, worsening asthma, bronchitis, and headache. FASENRA has no box warnings, and there have been no new safety signals identified since approval.
I went to an asthma specialist, and he ordered some blood tests and saw that my eosinophils were elevated. He said I have severe eosinophilic asthma and thought I'd be a perfect candidate for adding FASENRA to my treatment plan. I received my first dose in 2022. To say FASENRA has been a great medication for me is an understatement. At an appointment earlier this year, I discussed with my doctor not having any flare-ups and not needing steroids or needing to go to the ER for my asthma. I was able to get back to long walks and better breathing. I truly feel I got back to the things I enjoyed.
If you're seeking to help your patients with their severe eosinophilic asthma, have a conversation about FASENRA. Let's review the important safety information for FASENRA.
FASENRA, benralizumab, important safety information. Contraindications. Known hypersensitivity to benralizumab or excipients. Warnings and precautions. Hypersensitivity reactions. Hypersensitivity reactions, for example, anaphylaxis, angioedema, urticaria, rash, have occurred after administration of FASENRA. These reactions generally occur within hours of administration, but in some instances have a delayed onset, i.e. days. Discontinue in the event of a hypersensitivity reaction. Acute asthma symptoms or deteriorating disease. FASENRA should not be used to treat acute asthma symptoms, acute exacerbations, or acute bronchospasm. Reduction of corticosteroid dosage. Do not discontinue systemic or inhaled corticosteroids abruptly upon initiation of therapy with FASENRA. Reductions in corticosteroid dose, if appropriate, should be gradual and performed under the direct supervision of a physician. Reduction in corticosteroid dose may be associated with systemic withdrawal symptoms and/or unmask conditions previously suppressed by systemic corticosteroid therapy. Parasitic helminth infection. It is unknown if FASENRA will influence a patient's response against helminth infections. Treat patients with pre-existing helminth infections before initiating therapy with FASENRA. If patients become infected while receiving FASENRA and do not respond to anti-helminth treatment, discontinue FASENRA until infection resolves. Adverse reactions. The most common adverse reactions, incidence greater than or equal to 5%, include headache and pharyngitis. Injection site reactions, e.g., pain, erythema, pruritus, papule, occurred at a rate of 2.2% in patients treated with FASENRA, compared with 1.9% in patients treated with placebo in asthma exacerbation studies. Use in specific populations. The data on pregnancy exposure from the clinical trials are insufficient to inform on drug-associated risk. Monoclonal antibodies such as benralizumab are transported across the placenta during the third trimester of pregnancy. Therefore, potential effects on a fetus are likely to be greater during the third trimester of pregnancy. Please read full prescribing information, including patient information, at FASENRAHCP.com.
Thank you for watching.